Hi everyone, in this video we're going to be taking a deep dive look at sweating and how to understand that in terms of Eastern medicine. So I'm in TCM Weaver here and I've just typed in sweat and we can see there's a ton of results coming up for this, 281 results. So I'm just going to narrow it down real quick. The first place to start is to look at only the indications that have to do with sweating. So we're going to get rid of all the herbs, formulas, all that kind of thing. So we can see we've got basically 8 things to look at. Incorrect treatment sweating, that means that somebody had a diaphoretic treatment applied when they shouldn't have. Excessive sweating, profuse sweating, incessant sweating, spontaneous sweating, general sweating, no sweat, and night sweats. And these, out of all the 1900 indications we've got so far in the database, these are the 8 that have to do with sweating. And we've actually made no sweat into its own indication because it's such a specific sign. So some of the things we can do, we can start to explore this stuff. I'm just going to open up in a different window. I've already got this chart of like everything, and this looks like a ton of stuff because it is. But if you look here, we've got like no sweat and the herb formulas that are associated with that. So I turned off the patterns and things like that, but these are just the herb formulas that have some kind of association with no sweat or an absence of sweating. And of course we've got Ma Huang Tong is here. So I can zoom in a bit, make this easier to see because there's a ton of information here. So I don't recommend like staring at this thing too much, but we can see this as the master map. Same thing, just general sweating is right here. And I'm just going to zoom in on this. And there's our general sweating, and you can see the connections there. You could pull this apart and you could look at any of these specific formulas you want to do. So this is definitely an advanced way to use the Weaver software. Usually I recommend looking at smaller chunks of this so you can really focus on what you're doing. Something like this, incorrect treatment sweating. We see Shanju Yu coming up. So I'm just going to tap on that and we'll get the notes. And you can see now the context of what they're talking about, because this is an astringent type herb. So one of the indications is incorrect treatment sweating is used for Shanjuyu. Spontaneous sweating is here. We can see the associated formulas. Night sweats are here. We can see the associated formulas. Night sweats, are they always yin deficiency, right? That's the question. Not always. So you can see all the different things about sweating. And if you're in TCM Weaver, I would encourage you to take a look at this and do your own, research on this and go through and find the things that are relevant to whatever patient you happen to be looking at. But this is the overview, the big picture. And there's a lot of stuff here. So I'm going to break this down into something a little more straightforward and digestible. Well, let's take a look at this general sweating idea. And I've opened up the note, and yes, it's empty. Currently, it's just a placeholder for the indication. I'll go to the graph view. There's sweating. I'm going to open this thing up, and here comes everybody. I'm going to turn the center force down, and I'll turn the link distance up so that these things can breathe because there's a ton of info here. And we'll just kind of clean it up a little bit. I want the text size to be bigger so I can read everything. We'll make the link distance higher. Space them all out. We got a ton of stuff here. So for me, when I look at this, I like the patterns, but also the formulas kind of have patterns implied. So like this pattern, heat collecting in the stomach and lungs, etc. Like I'm just going to get rid of all the patterns on here so that I don't have to see them because they have long names and it clutters up my workspace. So we'll go there, and now I've got it's just formulas and single herbs essentially showing. So now we'll just clean this up a bit. Great. So, this is something that's like damn near impossible to do with books or any of the database software that's out that's very linear. There's a lot of great stuff. Like American Dragon's a great database. I've looked in that a ton. I still use it here and there. But there's no way to compile all the information this way. Same thing for like Clinic Aid and all these other things. But here we've got everything just at a glance. And yeah, it's a lot of information, but this is what we're looking at is like sweating in general. What's going on here? So sweating is really important for the immune system, especially when there's pathogens involved, exterior pathogens, that sort of thing. So let's take a look at some of the classic comparison here, because if we pull up Guizhi Tong, we are right here. I'm going to pull that one up, and we'll pull up Ma Huang Tong. And I'll show you how to overlap indications with this, because this is where it gets really cool for diagnosis. So I've got my 2 formulas pulled up. I'll go to graph view. And I'm going to use wander mode on both of them to expand them. So there's the Ma Huang Tong, all expanded, very nice. Guizhi Tong, we'll expand that out too. It's going to look like a ton of info because it is, right? And then I'm just going to go over here to my filters, and I'm going to turn off the single herbs. I don't need to see the ingredients of that. And I'm going to turn off kind of some of this miscellaneous stuff. And I just want to see basically the indications and the formula names. So there we go. So this is where the software gets really cool, because we have these super Venn diagrams and we can see the overlap, Ma Huang Tong's indications, fever, floating pulse, headache, and chills, that overlaps with Guizhi's indications, right? So if you had two patients and they both had these 4 symptoms, it's really hard to know which formula each person should get, right? But you can look at these things that aren't connecting, and you can use that as differential questions. Like, hey, is this person wheezing? Well, maybe it's more Ma Huang Tong, because I don't see wheezing over here for Guizhi Tong, right? But the two that I want to look at today is this no sweat with Ma Huang Tong and sweating with Guizhi Tong. And this is one of the big differentials in terms of trying to figure out the formula when somebody has this wind cold attack coming in from the exterior. So something to consider here is Ma Huang Tong has to do with this excess in the exterior, and Guizhi's got this idea that there's this deficiency out there, like we're not protecting our exterior well enough. That's why the sweat's able to leak out, is because we have some kind of deficiency, which isn't present with Ma Huang Tong. So the person who's more excess can handle this stronger formula, and the person who's more deficient needs the Guizhi Tong, especially the Bai Xiao in there, to help with that. So let's go to actually a piece of paper, and I'll show you some of the ideas about sweating in the pores, because there's a lot to this. So there's this idea in Eastern medicine that we have the pores of the body, and pathogens can come in to the pores if they're open. But the pores are like doors. We can also push pathogens out the pores with sweating. So we want to use sweating strategically, especially if there's a pathogen coming in, then we sweat it out. Now, the Ma Huang Tong versus Guizhi Tong problem has to do with if the pores are blocked, like the cold pathogen, the wind cold comes in and blocks the pores, then the person's not sweating. So you need to use Ma Huang to just really kind of crack those open and be able to push the pathogens out. However, if somebody is more of a Guizhi Tong type pattern, then they're already sweating. So it's not about opening the pores and pushing things out. It's more about harmonizing what's going on at the boundary. So this is the big distinction here in terms of how to treat pathogens, and if we're trying to promote the sweat, or if we're looking at somebody who's already a little bit deficient and is already sweating. But there's also different kinds of sweat outside of the context of external pathogens. So the first one to start with is just a healthy sweat, right? Because sweat can just be healthy. So if somebody exercises, right, that's supposed to cause a sweat. And when we exercise, we get hot inside of our body, and then the pores open up and the sweat comes out, right? This is a cooling mechanism. So this is healthy and normal. This should be happening. This is also, a bit of a detox mechanism, because if there's something near the exterior that needs to get pushed out, this is great. However, there is this Yangsheng, right, lifestyle practice of being careful when your pores are open. So what that means is being mindful and realizing that even though you've exercised and you've created a healthy sweat, that's normal and good. But once these pores are open, you need to take care of this area, especially like the back of the neck. And the idea here is we towel off, dry off, right? We don't let the wind and the cold and the damp and all that come in, because we've opened the doors. So if somebody does this, and this is where a question came up with our practitioner group here, but if somebody does exercise and then they don't really take care of the sweat and they wind up getting a cold, right? The pores have opened and now some wind, cold, damp, etc. is coming in. Now the person's going to get this early stage wind cold attack. But just because the person was sweating from exercise and then got sick, that's not the same thing as somebody who's sweating when they're initially sick. That's a Guizhi Tong pattern, right? You need to still differentiate, because the person could be sweating normally for exercise, get sweaty, the pores are open, the doors are open, the pathogens come in, and then they may be sweating with the fever, chills, that kind of thing, or they may not be sweating at that point. This person may need more of a Ma Huang Tong type approach. So there's different kinds of sweat, right? There's the healthy sweat, the physiology from exercise. There's also, even though some people might not think this is comfortable or pleasant, it is still physiological, which is the nervous sweat, right? Anxiety sweat, nervous sweat, right? Because we have a whole stress response where our hands can get slippery and sweaty. Sometimes different parts of our body can get slippery and sweaty. And it's all having to do with nervous system, right? It's not exercise. It's not because we are under attack from a pathogen and it's an immune response. It's just people get nervous and they sweat, right? So that's different. That's another different type of sweat. There's also sweat, more of the patho-driven type sweat, which could be like a dampness or damp heat, which can create sweating. And sometimes in these cases, the area of the body that's sweaty will tell you something about what's going on inside. So like a person may have a sweaty, very sweaty lower body, like lower burner, thighs, groin, these kinds of things. And that's going to tell you more that it's like dampness settling down to the lower burner usually. So somebody who's nervous sweat is going to usually be more like hands, feet, these kinds of things, maybe armpits. The person who's got damp heat, especially if the dampness is settling down, it's going to be more lower body type stuff in the groin and places like that. Healthy sweat from exercise is going to be all over the place, right? Because you're just exercising everything. People get sweat coming down their head and everything else. So we also have deficiency sweat, right? Chi deficiency, which is like the spleen, potentially the kidneys can be involved with some of these, potentially the heart, right? Whatever. It's all the astringent herbs, like the Wu Weizi type of astringent, right? Holding things in. You can get this deficiency sweat where it's unable to contain, right? There's also yin deficiency sweats, which are more like night sweats, that kind of thing. So just because somebody's sweating doesn't necessarily mean they need Guizhitong, right? Because Guizhitong is a certain type of sweat. It's a sweat when you're under attack, right? That's what's going on. The body's already leaking sweat. It's not been strong enough, so it needs this Guizhitong to harmonize, right? To astringe and also create more pressure by the capillaries. So that's one thing, right? But somebody with a nervous system sweat, they need a different approach. Somebody with damp heat and they're sweating, that's going to be, you got to clear out the dampness in that case. So you might be looking at more like a Sanrentong type approach. Qi deficiency, it's like the Fu Shao Mai or the Ma Huang Gen, these kinds of formulas, even the astringent like Mu Li, that kind of thing, right? And you can see all this on the blown out chart on the Weaver. I mean, this stuff's all over the place and there's a lot. I'm definitely not covering all of that right now, but the idea is the pores open for a reason, right? And just because the pores are open doesn't mean that's pathological. The pores can open and that's healthy and normal and good. The pores can also open and then close, right? And so people can have pores that are stuck open. That's kind of the idea with this Qi deficiency thing. It's like the doors don't close so that you just leak sweat all the time. It's like incessant, just low-grade sweat. And then there's also the idea that like the doors open and close just fine. It's just that there's a pathogen going on. So you need to be clear on what the sweat means and the etiology of what's going on with somebody catching like a wind cold attack. Because if you are exercising and sweating and then not doing the Yangsheng, the lifestyle stuff, that doesn't mean you necessarily have a Qi deficiency. It's not that the pores can't close themselves, it's that you didn't take care of it. Like you didn't shut the door, right? It's like a door that won't close versus a door that you didn't shut. Those are two totally different things. So there's a lot to do with this sweat, but in general, sweat is a product of an upward and outward pressure. So if you're doing 4-stage model, this would be generally stage 1, right? For some reason, there's an upward and outward pressure. Now with the deficiency sweat, it's because there's not enough downward and inward to balance it out. So it's kind of like the upward and outward is floating away, right? Like this kind of thing where you have, there's not enough balance, or you could do it on a scale, like those old school scales. Or we could do a teeter-totter. Actually, we could do like this, right? Seesaw. That'd be fine too. And there's your upward and outward type of actions. There's your downward and inward type of actions. And if your spleen and all that starts to get too deficient, then you're going to have more upward and outward. So it's a deficiency kind of sweat, right? This is not an excess sweat. That's the idea here. The dampness with heat, that's going to actually just be more and more pressure. So you're getting a lot more upward and outward until the pores open, hopefully to help vent some of that. But in those cases, actually, you could use some downward and outward to balance that out. Oftentimes, like Sanrentong approach, something like that, can help clear the dampness that's trapped, causing the heat, something aromatic. Same thing with the nervousness, right? The nervousness is this upward rushing, and even we'll get the like running piglet chi, that kind of thing. And oftentimes, not always, but oftentimes nervousness, you can look at anchor and sedate, right? So instead of down and out, it's down and in type therapies over here. And that's your more like Mu Li, Longu, right? That kind of stuff. So stabilizing and binding is basically just opposing this and closing it in. Anchor and sedate is settling it down. So we have a lot of distinctions here, but you just want to know that there is a healthy sweat, and sometimes even a healthy sweat, like somebody who exercises, and just simply not having the right lifestyle around that can leave you vulnerable to a wind cold attack. But that doesn't necessarily mean that that person has underlying Qi deficiency where the pores won't close, or underlying damp heat or underlying nervousness or anything like that. We don't know for sure because this is just an active part of physiology that's been mismanaged. There are other considerations too besides the etiology, like you might look at the quality of the sweat. Is it thick? Is it thin? Is it yellow colored? Does it leave stains on the clothing? What's the odor like? Is it a strong odor? Is there not much? There's a lot of different factors to look at. And with enough data points, we can start to figure out a pattern and a formula to go from there. All right, I hope this helps you understand sweating in Chinese medicine. Cheers.